One of the most frequent diseases in Mexico is systemic hypertension. There is an average of 15 million adults over 20 years of age who have this disease. The only way to detect patients with hypertension is by measuring their blood pressure levels. This procedure is learned by nurses and physicians during the first terms of their careers. However, most of them modify their measuring technique. Considering clinical standards, the auscultatory technique is the most useful method for measuring blood pressure. This method must be performed by using the following devices: a sphygmomanometer with different cuff sizes and a stethoscope. There are 3 different types of sphygmomanometers. One of them works with air. The second one is a digital device that works with electrical current or with batteries. And the third one works with mercury. For frequent measurements in the office, the one that is recommended is the desk mercury sphygmomanometer, because it is easy to move and it requires minimal maintenance. The digital sphygmomanometer is usually recommended for patients. The aneroid sphygmomanometer loses calibration easily. Cuff. The cuff is made up of an inflatable rubber bladder connected with rubber tubing to the manometer through one of the tubes and to a rubber valve with a release valve through the other longer tube. The rubber bladder comes in different sizes designed to cover at least 80% of arm circumferences. The cuff to use depends on the size of the patient's arm. It is not the same in all cases. The last part of the cuff is the portion made of material designed to hold the cuff in place during measurements. Stethoscope. This device has a diaphragm or a bell. Measuring procedure with the auscultatory technique. The patient is asked to sit and relax, and the procedure is explained. The atmosphere must be of comfort and quiet. The patient's arm circumference is measured to select the correct cuff. After at least 5 minutes of resting in a sitting position, the patient is asked to sit up and lean back against the chair. The patient is asked not to talk during the procedure and not to cross legs. The elbow must be placed at heart level and the arm must be bare. The cuff is chosen according to the patient's arm thickness. 15 centimeters for obese arms and 12 centimeters for thinner arms, with a circumference of less than 33 centimeters. The sphygmomanometer is placed in the observer's view. The cuff is centered carefully above the brachial artery, being careful not to fasten it too tightly or leave it loose. The lower edge of the cuff should be 1 inch above the antecubital fossa. The inflation level should be predetermined. That is, the amount of air needed to inflate it. Locate the radial artery to feel its pulse. At the same time, inflate the cuff until the pulse is no longer felt. The blood pressure valve must be identified in the manometer gauge, where the mercury level is located. 30 mercury millimeters must be added to the value registered. This will be the level at which the cuff must be inflated for measuring. Finally, deflate the cuff and wait 30 to 60 seconds before measuring the blood pressure. Gently place the stethoscope above the brachial artery, making sure that all of the diaphragm or bell surface is in contact with the skin. Inflate the cuff rapidly and continually to the previously identified level. The cuff must be inflated at a speed of 2 millimeters of mercury per second. When the last sound disappears, the mercury column must continue to go down for another 10 to 20 millimeters of mercury to confirm there is no more sound.
Not knowing or not applying the correct technique to measure blood pressure can be the cause of serious medical and ethical repercussions because the patient is exposed to the psychological impact of having a chronic non-curable disease that reduces his life expectancy, aside from having to have, in many cases, a long medical treatment that becomes an extra expense.